Hello, wow, what an experience. Welcome to Innovation Project video proposal presented by Veronica Fortu. The purpose of this project is to focus on leveraging imaging mobile information technology to enhance evidence-based practice in a video form that will answer questions regarding innovation projects. And according to Gerstner 2019, research has shown that the use of mobile app has played an important role in reducing the rates of hospital readmission by 92% and emergency room visits have dropped by 87%. The problem that this innovation project will solve. Let's go. This is the heart, stethoscope, hypertension, known as high blood pressure. Why is it important to monitor your blood pressure? Why is it important? Why is it important to monitor your blood pressure? Hypertension, first of all, is described as a persistent, elevated systolic blood pressure above 140 and diastolic reading above 90. And these numbers are lower even for certain ethnic groups, according to KCAL 2006. So why is it important to monitor blood pressure status? A blood pressure that is inadequately controlled can lead to the following medical complications: and organ damage, including heart failure, heart attacks, nephropathy, peripheral vascular disease, aortic dissection, blindness, or stroke. Hypertension is also known as a silent killer because the symptoms do not always occur until there is organ damage. And uncontrolled blood pressure can also lead to death. And so monitoring blood pressure is highly recommended, and it benefits individuals who are studying high blood pressure treatment to determine its effectiveness. And also people with conditions related to high blood pressure, like pregnant women experiencing pregnancy-induced hypertension, or what we know as preeclampsia. Blood pressure monitoring is also effective in evaluating potentially false readings, like people who only have high readings at the doctor's office, known as white coat hypertension. My mother-in-law's blood pressure always goes up when she's at the doctor's office. It will go up to like 220 over 102. Yes, one time she had a reading like that. So she always had a fright every time she hears she's going to the doctor's office, her blood pressure, which is anxiety. The people who and also people who only have high readings at home but not at the doctor's office, called as masked hypertension. This helps the doctor to understand what's going on. When you go with numbers, with a history, it helps the doctor to understand what's going on. Background to the problem, known as the prevalence of the problem. According to Sakarian and Dashparnik 2016, high blood pressure remains the most common of all non-communicable chronic diseases throughout the world, including less developed countries. A survey 2011-2020, 2012, the prevalence of hypertension in the United States has remained around 30%, and while awareness of hypertension has reached a laundry goal of 83%, the control rate is still only 50%, 49 for men and 55 for women. We're looking at here. This shows 48.3 and women at 62.6% for women in this age group. You see the age groups. So women have a higher rate. The readings are different for men and for women, and so therefore, though medicine has come a long way in the last 50 years in managing hypertension, from calling it essential to finding effective drug therapy for control, we are still short of truly overcoming this common malady of humanity. In fact, the annual number of deaths from hypertension in the United States still exceeds 30,000. AARP reports that the cost of treating high blood pressure is expected to continually increase, given the fact 1 in 3 adults in the United States having a diagnosis of high blood pressure. The cost can be extraordinary for some. On average, according to a new study, those with hypertension face nearly $2,000 higher annual healthcare expenditure compared with non-hypertensive peers. I'm going to take you to the next portion, which is the innovation collaboration. Throughout this assignment, 3 collaborators were interviewed. They were presented with the innovation project, presented with the device, and they were all interested. And all the individuals either had a history of high blood pressure or had someone connected with a history of high blood pressure. They wanted to give it a try. And the most captivating was the fact that they could download this to their mobile device for free. It could be uploaded for free. But the only side disadvantage is for those that do not have Apple devices. And so I'm hoping that in the future other carriers can implement this. They can have this in their store, so that patients or families can upload it to their devices across the board. And so the collaborators were concerned about data space and how the project could assist in medication reminders and diet optimization. And the one thing I forgot to mention right here was how this will affect the relationship with their primary care physician. Oh yeah. And so the next slide is utilization of appropriate technology. The technology in the device, the innovation project that is proposed here is called the BP Tracker Plus. The BP Tracker Plus. And the BP Tracker Plus will help one monitor the blood pressure at the convenience of their home. That is the one thing that I love. The patient can log their blood pressure, pulse, weight, here, weight, and more. There's even a spot for notes, so you can add whatever additional information you need. The tracker has an unlimited history right here. History, you can always go back and look at the history where you put in your blood pressure readings, your pulse, what time you took, if you after running, and you can also put it down. Keeping track of your blood pressure over a period of time is the best way to ensure good health. Each log will also display the date, the time, and show as shown on here. You know when exactly you took the measurement. Thus, it helps against hypertension and high blood pressure. Its major advantage are the ease with which the technology can be learned, reproducibility of value, sensitivity of measure, and availability of non-mutative data. Innovative solution. What solution does this present? What solution does this present? Although electronic charting has not completely replaced paper charting, you know, these days we all have sophisticated devices, cell phones, notebooks, Apple computer, and the Apple Watch is a new thing that was added, and we're still required to carry the paper version of charting for backup, just for backup. And so I am interested in a mobile device that will help monitor blood pressure numbers and implement effective treatment plans for patients at the comfort of their home. And the reason for choosing this app is the fact that, one, I've had the opportunity of serving in communities and in homes, and the one thing that is not being effectively monitored and the history is not being kept for the doctor's appointment is the blood pressure or charting on paper has not been very effective. About 80% of the population that I deal with have a history of high blood pressure, and the BP Tracker Plus app at no charge is a good idea. Christensen NL 2019 states that the transition from pen and paper, medical records portable or mobile records will drastically cut down cost of paper and burden involved in completing paperwork for caregivers. And so introducing use of mobile app device will give the patient autonomy, control of their own health, and also avoid costly mistakes that could send the patient to the ER. Jonathan 2006. Finally, according to Gershner 2019, medical mobile app devices are sure making a significant impact in the healthcare industry. This device says in the near future could even be able to diagnose and prevent diseases that could become a serious medical issue, such as heart disease or diabetes. As much as this is trending, I am hoping and praying that there will be accommodations are made for those that cannot afford a mobile device and not literate enough to operate one, it was a concern for one of my patients, and that there will be space made that could remind the patient to take their medication, and remind them, and as a slot for diet optimization, and also data security could be implemented, and secured effectiveness and reliability for making clinical decisions, and also to see how does this affect the patient and physician relationship. These are some of the concerns that need to be looked at and regulated as we move forward in this new venture. Thank you so much. It's been a great adventure. Thank you. And here are the references of where American Heart Association, AARP, and the app Blood Pressure Tracker Plus, Christian Scene, KC, Grishner, Jenna Hansen, Mayo Clinic, and this. And it's been a great experience. Thank you. Awesome.